Being a mother is a tough job, lalo na sa tuwing magkakaroon ng karamdaman ng ating mga anak at ibang usapin rin at may tuturing na masakit sa kalooban kung ang iyong anak ay ma-diagnose ng Autism Spectrum Disorder. Paano nga ba maaaring makaapekto sa kalusugan ng isang ina ang mga pagsubok na maaaring niyang kaharapin sa pag-aaruga ng isang anak na may autism? For the details, let's watch this.
Hello mga kasangbahay! I'm Dr. Grethel A. Vasquez, an obstetrician, gynecologist, and infertility specialist. Welcome to Women's Health. Being a mother is a tough and challenging job, yet it is very fulfilling. Kaya napakasakit sa mga damdamin ng mga magulang kapag ang kanilang anak ay na-diagnose with Autism Spectrum Disorder, kung saan ang mga batang na-diagnose with Autism Spectrum Syndrome ay mas nangangailangan na higit na pagkalinga, pag-intindi at pagmamahal mula sa mga magulang. At sa madalas na pagkakataon, it takes a toll sa mga magulang kapag nagkasakit ang kanilang mga anak. Ngayong umaga, pag-uusapan natin ano nga ba ang impact sa kalusugan ng isang ina ng pag-aalaga ng batang may Autism Spectrum Disorder. Ang pag-aalaga ng anak na na-diagnose with Autism Spectrum Syndrome ay minsan stressful sa isang nanay. Pero ano nga bang effect ng stress sa katawan at kalusugan ng isang ina? Stress can actually affect physical, mental, emotional, spiritual, and even social life ng isang nanay. Let's talk about physical. Ito yung parang laging pagod na pagod. Masakit ang katawan, masakit ang muscles. Minsan nga hindi pa nakatulog ng tama. Kung kaya tuwing umaga ang feeling natin laging pagod pa rin tayo. Dahil kulang tayo sa tamang tulog at pahinga. Ikalawa, emotional. Minsan masyado na tayong nalulungkot. Pwede siyang magkaroon ng anxiety, depression, even how they communicate with other people na apektuhan na. Dahil sa patuloy na lungkot na nararamdaman nila sa pagsubok na kinakaharap nila. Ikatlo, mental. Minsan hindi na sila makapag-isip ng tama. Palagi na lang silang may nakakalimutan. Ang feeling nila laging may kulang. Social. Kaya kung minsan ayaw na nating lumabas, nakukulangan na tayo ng oras para sa ating sarili. Hindi na tayo nag-i-interact with other people. Spiritual. Kaya kung minsan tuloy tinatanong natin, bakit yung sarili pa natin ang naapektuhan? Parang sa bawat araw, mas napapagod tayo dahil sa stress na nararamdaman natin sa ating katawan. Makikita natin, napakalaki ng epekto ng stress sa atin. Ito ay nakakaapekto sa ating kabuuan, isip, puso at pangangatawan. Ngayong alam na natin ang effect ng stress sa ating katawan, alamin naman natin paano natin matutulungan ang kalusugan ng ating mga nanay na nag-aalaga ng kanilang anak na may Autism Spectrum Disorder. Number one is we have to nourish ourselves. We have to eat proper and well-balanced diet. Kailangan kumain pa rin tayo. Kailangan kumain tayo na masusustansya. Kailangan hindi tayo nagsiskip ng meal. Kasi, pag may nutrisyon ng ating katawan, mas marami tayong magagawa. Number two is we have to engage into something physical activity. Remember that when we do exercise, we release happy hormones. We do stretchings. Nawawala lahat ng spasm sa ating katawan. Even it helps our muscles and our bones to regain strength. Number three, we have to look for emotional outlet. Kailangan, we have to be happy. We have to be with people who makes us happy. Positive outlook in life. We look at things in a positive perspective. We have to understand why we are experiencing these things. We have to learn to accept. And we have to be grateful sa lahat ng meron tayo. And lastly, we have to love ourselves. Kailangan bigyan din natin ang ating sarili ng panahon. Magbigay tayo ng time para makarecover, tanggapin, i-accept yung mga bagay, magpasalamat, at alagaan ang ating buhay. So, yun yung mga kailangan nating gawin upang matulungan ang ating katawan na mabawasan ang stress at mas maalagaan natin ang ating mga katawan. Again, mga kasangbahay, Being a mother of a child diagnosed with Autism Spectrum Disorder might be difficult and challenging, but always remember to love yourself, give time to yourself, eat a well-balanced diet, have a proper exercise, and most importantly, seek help. Work hand in hand with your partner, with your family member, to help raise a child with Autism Spectrum Disorder. Always remember that we are here to help you. That's it mga kasangbahay. I hope ay natulungan ko po kayong mga nanay kung paanong alagaan ang ating kalusugan upang mas matulungan natin ang ating mga anak. At para sa mga iba pang impormasyon at katanungan, pwede niyo po akong makontak sa aking Facebook page, Dr. Grethel A. Vasquez, or pwede niyo po akong puntahan dito sa aming ospital, Dr. Jesus C. Delgado Memorial Hospital, sa aming fertility center, Delgado Assisted Fertility Center. Or pwede rin kayo mag-consult sa klinik ko sa St. Luke's Medical Center, Quezon City. Muli, ako po si Dr. Grethel A. Vasquez, obstetrician, gynecologist, and infertility specialist. Palagi po nating tatandaan, lalo na po sa ating mga kababaihan, that our health matters. Maraming salamat mga kasangbahay!
Mothers should know too how to care of themselves dahil sila ang sandalan ng kanilang mga anak. At bago pa lumalim ang ating usapin ngayong araw, ay amin kayong iniimbitahan na i-follow at i-subscribe ang aming mga social media accounts. Please like and follow our Facebook page at www.facebook.com/DoctorsOnTV and like and subscribe to our YouTube channel. Just type www.youtube.com/@UNTV News and Rescue. And you can actually send us comments and mga questions po sa mga pages na yan. Naku, kaya after liking and subscribing, i-share nyo na din po sa inyong mga friends and family. Nako, di pa tayo tapos mga kasambahay. Marami pa tayong pag-uusapan mamaya. Sa pagbabalik po yan ng Doctors on TV. Welcome back mga kasangbahay! And to understand deeper what Autism Spectrum Disorder is all about, we have invited a pediatrician and also a consultant, a beacon in the field of pediatrics with wealth of experience and a passion for advancing children's health. Today, she graces us with her presence to delve into the critical topic of Autism Spectrum Disorder or yung tinatawag natin na ASD. So we are privileged to welcome Dr. Maria Veronica R, a Neurodevelopmental Pediatrician from Makati Medical Center. Good morning, Dr. Reloza, or should I say Doc Ivy, and welcome to Doctors on TV.
Hi, good morning.
Yeah, and you might want to greet muna po yung ating mga kasangbahay, Doktora.
Hi, it's nice to be here.
Okay, and thank you, Doktora, at pinaunlakan nyo ang aming invitation. Marami tayong matutulungan sa ating tatalakayin ngayong umaga. And to start with our discussion, Doc, para po sa kaalaman ng lahat, pagka sinabing autism, what exactly it is?
Well, it's a developmental brain-based condition talaga po. So children are actually born with it. There are some children who manifest it later on in life, but the thing is that they have a tendency sa genes nila to have autism.
Okay, sabi niyo po ang manifestation would be later on in life. I mean, ano po usually at kailan po nakikita yung onset ng autism sa mga bata?
Well, as I said, they're born with it na, no? But you start seeing symptoms, well, they say in the US as early as 6 months. But sa Philippines, I started studying autism 15 years ago. Sabi nila, the earliest that we've ever detected is 18 months. In the US, 16 months.
I see.
But you start seeing already at 6 months, eye contact and all. You can already see the difference.
I see. Okay. And yung mas late po, how late have you seen? Anong case po yung nakita niyong pinaka-late?
Funny thing is, they used to say up to 3 years old lang. But I have had a few patients that I've seen manifestations of mannerisms come out beyond 5 years old. So now they say that the very intelligent ones, you can actually diagnose them even in the school age. So that's why when we see that there's already a tendency or a danger, there are red flags, we have to monitor talaga. And it's you can't stop monitor.
I see. And dito ba papasok yung different types of autism?
Well, there's only one type of autism, but there's a spectrum. So you see the very mild and the severely affected.
I see. Okay, so you mentioned kanina na yung mga different ages po, no, kung kailan makikita yung onset of autism. But have you encountered a case na ang onset is as late as that person is in the adult stage already?
Oo, ibig sabihin talagang they had it when they were when they were born. But typically, diagnosis would be school age, not beyond that now.
I see. And,
Kasi kita na.
I see. And ano po yung mga risk factors para magkaroon ng autism ang isang bata or isang pasyente?
I would say you go as far back as when the mother was carrying the child. So it's a genetic condition. So there's the predisposition genetically. So kung may relative to the third degree in both sides who has it, there might be a tendency for the child to have it. When you have twins, the incidence is higher. When you have a sibling, the incidence is higher by 12%. But there's also a new area that they're exploring now. It's called epigenetics. I think that's something you might be interested, that you also have seen with what you do, no? Parang they're noticing that a child can have a predisposition genetically, and then environmental factors, even epigenetics comes in. So pollutants, etc., actually nick the gene and change it. Then sometimes there's a classic regression that we see.
I see. Okay, so we can say now that talagang autism is multifactorial.
Correct.
I see. Okay, so ang autism ba, or I mean, do autistic children commonly suffer from other illnesses also? May linkage ba sa ibang sakit, Doktora?
We commonly see gastrointestinal symptoms. So we have constipation, diarrhea, gastroesophageal reflux. So you have some children with autism who can't talk, but suddenly while they're lying down, they'll bolt up and throw a tantrum. Yun pala, the acid went up, no? So we also work with other specialties for those things. So
I see. Yung sinasabi na Doktora na autistic savant, what is that?
oh, those are the very bright ones. So on the other end of the spectrum, the mildly affected, we have the ones that we used to call Asperger's. So Asperger's are very intelligent but with social differences usually.
Okay, so when you say social differences, ibig sabihin may antisocial factor ba?
Yeah, they come across as a little bit unusual. They don't. They have unusual mannerisms, or they may have ways that are different from ours socially.
I see. Okay, and kamusta yung mga manifestations po ng mga patient who are autistic? Okay, so ibig sabihin yung mga, sa ating mga viewers na when you say manifestations, yung mga nakikita, so sa mga bata, mga senyales, okay, and para magkaroon ng, syempre bago naman ma-diagnose ng doktor, yan ay may mga napapansin muna ang kanilang mga kaanak, ang mga family nila. Okay, so usually ano po yung most common finding po, I mean, in the house premise?
Oh, so the very first thing you'll see is a difference in eye contact. So, yan ang mga first 6 months. So, typically, you'll see a baby looking back, exchanging yung gaze with you, smiling back.
As early
2 months,
as pag
diba?
normal, 2 months.
So, yeah.
Okay.
So, pagka 6 months, wala pa. Oh, that's a red flag na. At 18 months, the child with autism will also not be able to point pro-declaratively. So, they will pull to show what they want. And then lack of words, no, at 1 year.
When, doktora, compare natin sa mga normal toddlers, okay, gano'n po dapat ang nakikita yon, yung gano'n nakakapag-point na as early as what?
18 months.
18 months
Correct.
dapat. Pero pagka beyond that and wala pang gano'n, so isa sa mga red flags.
And then what you'll see, instead of pointing with their own finger, they'll take your hand mechanically and use your hand to point to it. So it's a little bit unusual talaga.
I see. But how about yung yung mga sinasabi nila na parang extra bibo yung mga bata. Okay, so meron bang ganong group talaga? May makikita ka talagang percentage ng mga autistic? Or ang term nila, nakita mo itong bata to parang mukhang kakaiba yung pagiging genius. Minsan yun ang term nila. Dito pa how do I say that? Dito may linkage sa autism o it's another kind of disorder?
Well, I don't know if you're talking about the children who are hyperlexic, who read early on. But when you say bibo, I'm not so sure about what you mean by bibo, but probably they're hyperactive.
Hyperactive, I guess,
Yeah, that's still part of the spectrum. So, the very mildly affected ones.
I see. Okay, kasi ang daming mga myths, di ba, about autism. And can you name a few, Doktora?
Well, the very first myth that they had early on in the 1940s is children with autism are the way they are because parents are cold and they don't attend to these kids. So which really tortured parents then, di ba? That made them feel bad. But it's a myth because children are actually born with it genetically. It's not the fault of the parents. So that's the first thing we want to say, no? Na it's not the parents' fault, but certainly the parents play a big part in making the child better because it's a spectrum. So what we usually see is children are born a certain way, but there's definitely a lot of hope there. And the parents are the first ones who are the ones who can help bring the children to really improve. So, yeah.
Okay, we've been talking about yung kanina yung mga red flag, ganyan. Okay, so how would you know na parang baka ito may autism tong bata? Siyempre, dadalhin po sa kanilang doctor, no? And in the event na ma-diagnose, okay, of autism, so ito, paano nakaka-affect po yung autism sa development, okay, nitong bata?
Well, it affects language definitely. So these kids are not able to communicate their needs, or eventually they will, but slower than their peers. Later on, it might affect schooling. So because school is learning is language based, so they might have reading and learning problems in math, and then eventually it also affects their prognosis in living independently and learning to take care of themselves. So madami yan.
I see. And if kunyari a parent suspects that her kid, okay, is having probably autism, ano yung first thing na dapat niya gawin?
Okay. Well, the first one to probably speak to would be your general pediatrician, because they've been handling your child for so long, no? And then ask na for help, no, for probably screening with something like MChat, which your general pediatrician can do in her clinic. And then if they see that there's a tendency or a high suspicion of autism, refer na to the developmental pediatrician for assessment.
I see. And okay, so once na-diagnose talaga na this is actually a case of autism, and say pwede nang yung age ng bata na yun during the diagnosis or the time of diagnosis ay pwede na mag-schooling. Okay, so nakaka-attend ba sa regular schooling po ang ganitong mga bata?
Oh yeah, certainly. We do have some smart kids with autism who eventually able to mainstream and even join traditional schools, but because it's a spectrum, we really cannot say for sure. So there are those naman na we do everything that we can, but they remain to have really intellectual disabilities and who can't go to school. So iba-iba, but there are even people with autism abroad who are able to live independently. So about 20% of people abroad with autism are living independently, actually getting married.
I see.
Actually becoming professionals. So it's
so
very
meaning
hard
to
to
say-
box them in.
Okay, and so we do not want to limit naman yung kanilang potentials, and of course yung magiging growth nila in different aspects. Okay, even despite the diagnosis of autism, I mean, ibig sabihin someone can actually outgrow autism. Does it suffice to say that?
Well, probably in the layman's term, but really when you're born with it, you're born with it. So you don't really outgrow it, but you climb up the spectrum and seem almost neurotypical, but the tendency is still there. So sometimes we will pull away na from therapy, but once in a while they'll come back and say, oh, we have a problem with this. Hindi siya makakope, he doesn't know what to do. So we have to support again.
I see. But there's really a percentage na who can live independently naman, Doktora.
Yes, we haven't established that locally, but abroad, 20% daw can live independently.
I see. And so with that, kahit pa paano talagang medyo nakakalungkot din, no? Yung nagiging life, okay, ng mga autistic kids, no? And so primarily, alam ko marami kanina kayo nga minention about yung mga risk factors, ganyan. And and having mentioned about being multifactorial, okay? So hindi natin pwedeng sabihin na it's basically the pregnancy alone ang reason why nagiging autistic ang kid.
Yeah, oh, that's true. Well, one thing we can do though that I want to put out there for people who want to have children, women, please take folic acid. It helps now, no? So 3 months prior to pregnancy, it helps lessen the risk. And then when you see a symptom, approach right away for therapy, because the earlier you start, the brain cells of a child kasi po before 6 years old is very neuroplastic. So the earlier you start hammering with therapy, rewiring is happening. By the time they age, halos hindi na halata yung kanilang ano. So, although you say nakakalungkot because, of course, there's a diagnosis and we understand parents will be sad, but it's going to be a lifetime of hoping and working with your child and even learning yourself from the child. So, it's nice. I actually have even one patient who became a pianist, jazz artist. So, it's very exciting to see what they can become. I had another patient na the father never gave up, taught her to go snorkeling, diving. She's an athlete. So it's actually very exciting. It just depends on how you look at it.
Okay, and usually this, parang you would have really to monitor these kids, ano? And ganong katagal sila dapat nakatutok sa isang developmental pedia, Doktora? I understand, di ba, pag pedia, forever.
So we see them every 3, every 6, every 9 months, every year, depending on the need. As they age, adolescents, we pass them on for transition care to child psychiatrists, later on to psychiatrists, adult psychiatrists. So as they age, their concerns become different. It's emotional. We have to support them kasi there's depression, there's anxiety, which common people get. All the more for people with autism who have a disconnect. So that support goes on forever.
But how about the other medical illnesses? Are they prone to like certain diseases or not really?
Well, you're talking about like
Other disease, I mean, meron po bang correlation with other mga sakit, okay, na mas prone ba sila? Like for example, if I may mention, like yung mga sa may Down syndrome. So at certain age, parang they're prone to have like certain cardiac diseases. Ganyan. And how about with Autism Spectrum Disorder? So may ganun din ba silang correlation with other medical conditions?
Well, the comorbids, as I said, gastrointestinal. There's also mood disorders, ADHD, learning disabilities, things like that. But if you're talking about cancer and all that, wala pang na-establish, I think, that I'm aware of na. As bit like when you talk about Down syndrome, they're prone to leukemia. No?
Yeah.
So, well, another thing to mention is seizures.
Oh,
So we have to watch out for that, seizures.
Okay, and just like any other condition, pag dito sa autism po, I mean, you mentioned kanina, meron kayong dapat nakikita every 3 months, 6 months. On the average, how frequent should be the interval, okay, that an autistic kid be seeing yung kanyang doktor?
I would say 6 months.
6 months.
Oo.
And pero I understand, nadidinig natin, grabe yung pila ng appointments ng mga developmental pedia, di ba, Doktor?
Kasi po, konting-konti kami. When I started out 15 years ago, we were about a little bit over 10. But now, because madami na yung schools who are training, hospitals who are training, we're about 120 plus na.
I
So
see.
it's faster now.
But for sure, no, like ako, if I know somebody, I would really advise na maganda pa rin kasi kung sino yung nakakilala sa bata, okay, from the time of diagnosis, syempre para at least may familiarity din sa part ng pasyente,
Correct.
diba?
That's what we're always pushing for, no? Kasi you cannot be doctor shopping and going from one DevPed to another because the baseline is different. So you don't have that, that it will always be good to go back to the one who saw you first. Kasi iba yung nakita niya noon. Please stick to your DevPed from the start. That's really one important thing.
And
I'm glad you mentioned
and
that.
if there's a need for you to be, you mentioned about the transition to another doctor, di ba? So, maganda namang gagaling pa rin yun doon sa primary doctor, yung unang
Correct.
nakita. Kasi, I mean, that particular doctor already has yung inyong yung history, lahat ng mga examinations na napagawa before.
Correct.
So, that is very important, especially that we're dealing with like behavior, Doktora.
Oo, correct.
Yeah. Okay, naku, napakarami natin information na natututunan, Doktora. And this is getting more and more interesting. Okay, naku, pero mga kasambahay, no? Marami pa tayong pag-uusapan about Autism Spectrum Disorder. And let's pause here for a while, Doc. Dahil magpapatuloy po natin maya-maya lamang. Kaya mga kasambahay, huwag niyo pong ililipat ang channel. Magbabalik po ang Doctors on TV. Nagbabalik po ang Doctors on TV. Naku, at para pa rin po sa pagpapatuloy ng ating talakayan, still here with us is Dr. Maria Veronica R, a Neurodevelopmental Pediatrician from Makati Medical Center. Naku, Doktora, kanina nga, Doc Ivy, kanina po napag-usapan na natin yung mga causes and other risk factors, no? Ngayon naman po ay pag-uusapan natin yung mga diagnostic measures, saka po yung mga treatment options para sa mga bata na pasyente na na-diagnose ng autism. Okay? And, Doktora, dito tayo sa diagnosis. Okay, so how do you diagnose this condition?
Well, it's mostly observational. We do tests to measure the skills of the child while the child is working with us. We see observations of eye contact, speech, and mannerisms. But if you want to go gold standard, we do what we call the ADOS. So it's specific for diagnosing autism talaga. So we have that naman in the Philippines.
So how do you do that?
Spending about 2 hours, matagal siya, no? So it's a 2-hour test, spending it with a child, working with a parent and with a clinician, and observing many things like imaginary play, basta madami po yan. Mahabang mahaba. So I trained also for that, but you have to have the materials for it. So,
So
yeah.
basically, it's clinical diagnosis. Okay.
Correct. It's
Not so much
subject.
of mga medical tests, ganyan, doktora.
Correct.
Okay, so how about mga screening tools apart from dun sa na-mention nyo kanina? Ano po yung mga nire-request natin to screen for, well, possibility of autism?
Oo. So
In
it's
that
just,
case.
just the MChat and the infant checklist. Basta your pediatrician, if they observe, that would be almost like the hint that, if you need an assessment with your DevPed. So if you talk about tests that we would actually run, if we suspect autism, if there's a suspicion for seizures, we would ask for EEG when they're very young, especially, or when they're adolescents. Those are the 2 peaks in their lives where they might have seizures. They're more prone to it than the normal population.
Okay, once diagnosed of autism, so nakita nyo na nga with all the tests that you were mentioning earlier, and then what is the next step after diagnosis?
So after diagnosis with us, after the assessment, we refer for therapy. So there would be occupational speech therapy, sometimes physical therapy. Others would include behavioral approaches like ABA, but we don't have much of that in the Philippines. So it's very limited. So we don't always get to refer it for ABA, but we do have that. And there's what some parents want to check out, no? Like they call it CAM, the complementary alternative adjunct medicine, like what you do. Yeah.
Okay, and can autism still be cured? Or a lot of therapies for long?
Well, because it's genetic, it's not cured per se, but we are able to make it improve over time. So we try to approach neurotypical as much as we can.
Okay,
But
and
these people have their special talents, which are also very nice.
yeah, can you share like some stories about some of your patients?
Yeah, like so what I said, I had one who became a jazz artist. He's a pianist, and then I had one patient who was really diagnosed in the US. Umuwi lang siya po for summer to visit the grandparents. She was so good that eventually looked like she didn't have it. She was chatting with her parents. She had a sense of humor. She went to college. Parang walang problema. So these are things that we like to look forward to. Of course, they're goals, but they're not. We also want to tell the parents na it's not always the case. Each story is different, but each story is beautiful. So sometimes they will not be able to reach that far, but at least we tried, di ba?
Yeah.
So, iba-iba po sila.
Actually, I asked you to share some stories because I would hear some stories also from other parents who have autistic kids, no? Parang may mga anak siya magaling sa arts, ganyan.
Correct.
Yeah,
they have
make
special
good artists,
skills.
yeah.
That's why we encourage po parents when they're very young, 4-year-old and 4 years old, and so start trying to observe kung ano yung hilig nila.
The interest.
Yes, and then make sure you invest in that. So this little boy who became a jazz artist really had a special ear for music. He could identify what classic music it was, what piece it was. He could name it.
Oh, he's a music genius.
Talaga. So, or if they like playing with art, have them trained in art. So they can really be super good.
Okay, Doctor, and then I would also hear about yung may mga therapy centers, okay, na parang swimming yung kanilang nagiging activities, and marami pa sila, like yun nga, merong arts class, ganyan. So, and how does this, or how do these therapies, okay, therapeutic interventions help the autistic kids that we have dito sa community?
Development is a ladder, no? So you can't reach the upper rung if you don't step on the lower rungs. So the therapists study the developmental milestones, that progress as the child ages. So they take them there from the lower up, and so they do tabletop activities, or they do obstacle courses, or they try to guide the child in picking up language, etc. So if you talk about aqua therapy, that's a form of occupational therapy. So they use the sensory benefit from the water to help calm the child down, and also to teach them to swim, which is a survival technique also. So it's okay.
Kasi my kids, I have twins and they swim, and then merong certain time na autistic kids they have swimming classes also. And I'm very happy to know na may mga nakakapag-compete and mga nananalo na mga swimmers. Okay? So basically, talagang tama yung sinabi nyo kanina na kailangan makita lang yung interest ng bata. Okay? And then para at least mas ma-focus niya yung sarili niya doon, 'di ba? And okay, so how about yung yung iba naman they subject daw sa isang speech therapy yung ibang mga autistic kids. Kailan kailangan ng need ng speech pathologist ng isang autistic kid?
Actually, speech therapy is very, very important in autism because it's one of the core issues in autism is a lack of language, no? So usually we start speech therapy when the child is able to sit and tolerate and follow and imitate. In a typical child, they'll be able to imitate at 2, but for autistic children, it comes later on.
Hindi.
So once ma-OT muna po sila and then they're able to behave, then we start the ST.
I see. Pero doktora, about dun sa speech na napag-usapan din natin, kapag ba nagkaroon ng delay ng speech ng bata, can it be a sign also?
Definitely. It's one of the core problems in autism. So there's a lack in social communication. So there's language issues. There's also a lack of use of language to interact.
I see. And pwedeng not necessarily na vocal language or verbal language. Yung sabi nyo kanina, hindi eye
Correct.
contact.
Non-verbal communication is
Yeah.
also down.
At yung kanina na sabi nyo, pag may ipinopoint, ganyan, okay. Dun sa mga may delay sa speech, ano ba yung normal, okay, na dapat nakakapagsalita ang bata?
Single words at 1, at 2 years old, 2-word combinations. At 3, 3-word combinations. And at 2, dapat innumerable na po yung words ng bata. Hindi mo na mabibilang sa dami.
So at 1, kung wala pa, medyo alarming siya. Okay, so pero pag wala pang 1-year-old, so pwede hindi muna mag-panic ang parents.
Well, you'll see it in the eye contact.
So depende kung meron naman nun. Okay, okay. So at least marami din pala tayong mga notes to observe, okay, sa ating mga bata, sa ating mga babies, no? Okay, and so kanina na-mention din natin yung occupational therapy. How about yung mga oral medications? Meron bang mga pinaprescribe sa mga autistic children?
There's 2 medications that we use in autism. They're both antipsychotics. So there's Risperdal and aripiprazole for irritability and all. So those are the 2 meds that we play around with. Other medications probably are for if we see hyperactivity, ADHD, then we would add the others on. Other medications we give for kids who they say that melatonin is lacking. So sometimes the sleep cycle is down. So sometimes we also give melatonin for 4 and above.
I see, okay. And siguro, depende sa need niya. Like kanina sabi niyo kung merong a seizure disorder on the side also. So, depende sa need. Okay, so it's very important na meron talaga nakatutok, okay, na doctor dito sa inyong mga anak, no? Especially those diagnosed of autism. Okay, and how about doktora, yung mga iba nilang, may mention what's that, Tourette syndrome? How is it related to autism?
Well, it can coexist. It can be, it can happen with autism, even catatonia, etc. So, madaming comorbid ang autism As I said, even ADHD.
I see. And are dietary interventions also helpful to autistic children?
Anecdotally, if eating too much sugar makes them more hyperactive and difficult to handle, then you know that you should curb the sugar, no?
Yeah.
But if you're talking about, and definitely they also need to be very well nourished. So some kids with autism are very picky with textures and all. So ang nangyayari, they don't eat everything that they should in the food pyramid, and then they become nutritionally deficient, and it affects their cognition. So that's also important. You have to train them to eat well.
Siguro, Doktora, another question which I think is very important. How critical is the support system of the family of a patient who has autism?
Very, very big part in prognosis. So when we talk about wanting to have good prognosis, there are 3 prognosticators. 1, you start early intervention. So, sana before 4.
Why, Doktora? Sorry, I need to ask. Bakit pagka delayed? Alam natin sa ibang sakit, parang complications may have set in already. But in the case of autism, bakit kailangan na early ang intervention?
Because of the neuroplasticity of the brain for children. So, it's optimal before 6 years.
So we want it before it has
Correct.
fully developed already.
Because we want to use that window when the brain can really recover faster than adults, diba?
Yeah.
So we want to make the most of that. So that's 1, early intervention. The child has to be smart, of course. And the 3rd is what you said, that the parents have to support the child talaga po well. So when we talk about support, it's not just financial, it's emotional, it's language, it's doing things with the child. Everything. So we always have to go back to the home. Discipline in a nice way, firm, consistent approach, talk to them often. Gadgets, none before 2 years, 2 to 7, only 1 hour at a time in a day.
Oh, kasi it's a factor also, Doktora.
Definitely, kasi they become inattentive and then
So
there's less chance to engage.
Would you advise that also sa parents of normal kids na bawal muna ang gadgets before 2 years old?
I understand that the generation now, that's something they can't avoid, no? And in fact, that's like what my son said. That's how they talk to each other because they game together. So it's a little bit too much to ask of them to really put it down, I know, but ideally, yes. You know why? When we were younger in our generation, the imagination, when you're bored, is something else. We want that for them. You want them to be bored so that they can imagine. So we can't have that if we have too much gadgets.
But ngayon wala na silang ganyan Okay, kasi they're always busy.
Kaya nga.
Yeah. But naku, thank you very much, Doktora. Siguro bago ka tapakawalan, do you have like some final words for our viewers?
Well, autism is a lifelong thing, but we don't have to think that it's a death sentence. It's hard to say, but it's something that's rewarding if you put all your effort and heart into it because you know that whatever happens, you made the most of it. And the funny thing is, these children actually also teach us something.
Yeah. Thank you very much, Doktora. I can feel your compassion sa mga pasyente mo. Ang dami kong natutunan and I'm sure yung mga viewers din natin. And you might want to invite our viewers to visit you here at Makati Medical Center. Baka may gusto kayong batiin, Doktora.
Well, hello to my family. I always, after work, it's always my family. So I hope the same for the viewers. Spend time with your family a lot, no? And then we're 4 dev beds in Makati Med, so come see any of us if you have questions.
Thank you very much once again, Dr. Maria Veronica R, a Neurodevelopmental Pediatrician from Makati Medical Center. Naku, we hope mga kasambahay, marami po kayong natutunan sa ating talakayan kanina with Dr. Reloza. Naku, di pa tayo tapos mga kasambahay, marami pa tayong pag-uusapan mamaya. Sa pagbabalik po yan ng Doctors on TV. Nagbabalik po ang Doctors on TV. Ngayon naman ay maghahatid pa kami ng kaunting kaalaman kung paano ang epekto ng drama therapy sa mga batang may autism. Panoorin po natin ang mga detalye only here at Baby Talk. Magandang araw mga kasangbahay. I am Dr. Katrina Florcus Dacanay, your pediatrician for today. Ang autism ay nakikita natin habang bata pa. Ito ay isang kondisyon na nakakaapekto sa paglaki ng isang bata. May ibang tao na may autism na kayang mamuhay ng mag-isa, samantalang ang iba naman ay maaaring kailangan ng tulong sa pagkatuto at nangangailangan ng gabay ng espesyalista habang panahon. Kaya naman, ating pag-usapan kung ano nga ba ang mga early signs kapag may autism ang ating mga anak at kung ano ang best therapy para sa kanila. So, let's start our discussion now. Maraming therapies and treatment options para sa autism. Ang mga treatment na ito will include behavioral, developmental, educational, social, relational, pharmacological, psychological, at meron ding complementary and alternative management. Isa ang drama therapy sa mga paraan para i-manage ang autism. Ang drama therapy ay isang uri ng psychotherapy na ginagampanan ng trained na drama therapist. Gumagamit sila ng storytelling, role-playing, movement, dramatization, at improvisation para sa therapeutic change, adaptation, at self-development ng isang batang may autism. Ayon sa ilang pag-aaral, ang drama therapy ay nakakatulong sa mild to severe challenges sa pakikipag-interact at communicate sa ibang tao. Tumutulong din ito sa isang bata na may autism na ma-process ang social-emotional experiences niya. Para sa mga batang may autism na sumasailalim sa drama therapy, ilan sa mga activities nila would be yung storytelling, imaginative play, paggamit ng mga props tulad ng mga dolls, mga puppets, at gumagamit din ng mga theater techniques tulad ng improvisation at performance. Tumutulong ang drama therapy sa pag-process ng thoughts and feelings ukol sa difficulties, incidents, beliefs, or assumptions and new behaviors. Nakita din sa studies na ang drama therapy ay nakakatulong sa social abilities, communication, at cooperative play ng isang batang may autism. May pagkakaiba ang play at ang drama therapy.
Ang play therapy ay madalas ginagamit sa mga bata, samantalang ang drama therapy naman ay pwede sa mga bata, teenagers at adults na may autism. Ini-encourage natin ang play sa mga batang may autism. Play kasi is an important part for kids with autism. We encourage them to play sa mga iba-ibang environments. Ginagamit din ang play upang mag-develop ang mga bagong skills at ginagamit din ang play para sa kanilang mga thinking and learning skills. And that's it mga kasangbahay. Sana ay marami kayong natutunan sa araw na ito. As always, consult your pediatrician for your baby's health. Salamat again for watching. I am Dr. Katrina Flor Cruz Dacanay. You can reach me through my Facebook and YouTube channel, Dr. Katrina Flor Cruz, Instagram and TikTok, katrinamd.ph. Thank you once again and I'll see you in our next episode.
And that brings us to the end of today's enlightening episode. But before we say goodbye, please watch this.
Watch these snippets for the upcoming episode on Sunday.
So, ang leukemia, sakit yon sa blood and bone marrow. So, para maintindihan natin yon, ang leukemia is the most common cancer sa bata.
At yan po mga kasambahay ang aabangan natin sa susunod na linggo. And as we wrap up today's episode, we'd like to extend our gratitude to all our viewers for their continued support. And syempre, bago po magtapos, gusto ko rin batiin ang aking kambal, si Iyo, si Iya, si EJ, hi din kay Doc Alain, and sa mga pasyente natin sa Barba-Cabodil Health and Wellness Center. And of course, nanay and tatay, I love and miss you both. Hi also to Sir J. Eusebio, our General Manager of BMPI. At syempre ang ating mahal na si Kuya Daniel Rason na walang sawa pong sumusuporta sa mga adhikaing public service. May God always protect you and grant you a healthy life. At sa ating mga kasambahay, maraming salamat po sa patuloy ninyong pagtangkilik sa Doctors on TV. And please like and follow my Facebook page. Just type on Facebook search box, Dr. Sarah Barba-Cabodil. We hope you found this discussion informative, empowering, and inspiring. Remember to follow us on social media for updates. Don't forget to tune in next time, God willing. Muli po, maraming salamat sa inyong lahat. Ito po si Dr. Sarah Barba-Cabodil. Let's make it a habit to learn about good health, only here at Doctors on TV.
We would like to thank Makati Medical Center, a hospital with a heart. Located at Amarsal Street, Legazpi Village, Makati City. You may contact them at 632-8888-8999. Like and follow their Facebook page at I Am Makati Med, or you can visit their website at www.makatimed.net.ph. Makati Med Wellness Center, located at 7th floor, Ayala North Exchange Tower 1, Legazpi Village, Makati City. We would like to thank Adlaon Optical, located at ground floor Super 8 Warehouse Poblacion, Baliwag, Bulacan, 0922-878-5911, and second floor Aliw Complex, MacArthur Highway, Calvario, Meycauayan City, Bulacan, 0922-861-2095. Asian Breast Center is the premier healthcare facility dedicated to breast health and wellness. It specializes in breast cancer diagnostics, treatments, and disease management, offering state-of-the-art technologies in treatment guided by American standards and guidelines. Visit their Facebook page at facebook.com/Asian Breast Center PH. The Asian Breast Center is located at the 8th floor of Centuria Medical Makati, located in Galayaan Avenue, corner Salamanca Street, Barangay Poblacion, Makati City. The center is open Monday to Friday from 9 a.m. to 4 p.m., except holidays. To get the best level of care, you can book an appointment by calling their mobile number at 0917-127-3278 or send inquiries through email ask.abc@asianbreastcenter.com. Breast cancer is curable and treatments are affordable when detected and diagnosed early. Lindison Gas Corporation, located at 179 National Road, Landayan, San Pedro, Laguna, 4023. For inquiries, you may contact them at 02-8824-0867 or 02-824-9360, or you can email them at lgsalesco@gmail.com. Clinica Figura, located at Entrata Building, Philinvest, Alabang. You may contact them at 0917-317-7272. Barba-Cabodil Health and Wellness Center, located at Unit 1531, Centurion Medical Makati, Century City, Makati. You may contact them at 0917-317-7272 for appointments and other inquiries about your health and wellness needs. Dr. Sara Barba-Cabodil would like to express her gratitude to Medical Depot, healthy num-num food. Really do.